So the financial conflict of interest policy is actually a DHHS policy, but it requires recipients and investigators to comply with the requirements of 42 CFR 50, subpart F, which is entitled The Responsibility of Applicants for Promoting Objectivity in Research for which PHS funding is sought. And that subpart requires that each institution maintain an appropriate written policy on conflict of interest that complies with the subpart and informs each investigator of that policy and their reporting responsibilities. So all financial conflict of interest must be disclosed before a PHS proposal can be submitted. And that includes any subrecipients, consultants, or collaborators. They must disclose as well. Prior to expenditure of any PHS funds under a new award, an institution must report to NIH or whatever DHHS agency is the existence of any conflicting financial interest and assure that that interest has been managed, reduced, or eliminated in accordance with regulations. And then if any FCOI arises during the course of award, it must be reported to the agency along with a plan for management of that conflict of interest. The conflicts must be reported within 60 days of identification, and your institutional conflict of interest officer will submit an FCOI report on ERA Commons. All investigators on a PI's project team must complete conflict of interest training prior to conducting any research with PHS funds. This includes new team members added during the project period. And an investigator is defined as the project director or principal investigator and any other person, regardless of title or position, who is responsible for the design, conduct, or reporting of research. So that includes co-PIs, co-investigators, postdocs, graduate students, anybody who's responsible for the design, conduct, or reporting of the research. Consultants may or may not qualify as investigators. It really depends on their role. And service providers are not considered investigators usually because they're usually a fee for service. So they really wouldn't have anything to do with the design or conduct of the research.